This is Dr. Clark, and this is Antiparasitics and Anthelmentics. With parasitism, what you have is you have the host and then you have the parasite. And so the parasite is going to cause some type of harm to the host. It can be removing nutrients, it can be passing on disease, it can be removing fluids such as blood and water. It can cause pruritus and cause intense self-mutilation. So there's going to be something harmful that a parasite ends up doing to the host species. Sometimes this is going to be localized, sometimes this can be a generalized impairment, and in some cases it can actually even lead to death. One thing to know about parasitism is that some parasites can actually be transferred to people. So some of these things that we're going to look at will actually be zoonotic in nature. Parasites can be contracted from animal to animal contact, ingestion from contaminated food, water, or other sources like the ground, insect transmission, and then contact with the parasite. So like walking on it, rolling, so any infected soil, any of those things, you can actually pass it from one animal to the others. A lot of times parasites, it depends on the load as to whether or not they show clinical signs in the animal. There's a lot of times an animal will look healthy, but they'll have some load of parasites, and some is probably somewhat normal to have a slight amount of parasites in the body. It's just trying to control it to where it's not causing any major disease or clinical signs, or it's going to become a life threat to the animal. A lot of times we're having to use microscopic determinations on some of these parasites, even things like skin mites. Sometimes we have to look underneath the microscope. Most common thing when we're looking for internal parasites is to try to do fecal examinations, things like fecal flotations. Some of your basic terminology is you have endoparasites and you have ectoparasites. So endoparasites are going to live within the body and ectoparasites are going to live outside of the body. And we treat both of these endo and ectoparasites. So endoparasites would be things like hookworms or tapeworms, would be endo on the inside. Ectoparasites can be like flea and ticks. Sometimes some medications that we give for internal parasites will get rid of some external parasites. And then there's other times that some of the medications are going to be totally separate. And then how we apply them. Endoparasites are going to usually be oral. Sometimes with ectoparasites, or actually a lot of times with our ectoparasites, those are going to actually be topical, right on top of the surface of the skin. So looking at endoparasites, the ones that live on the inside, we have a category of them that's known as the helminths. And so these are going to be things like nematodes. That's going to be your typical roundworms. And then we also have another group, which is the platyhelminthes, which is going to be things like cestodes, which are your tapeworms, and trematodes, which are your flatter fluke worms. And so when we look at these, we're going to put the drug class depending on which one they're going to work on. Anti-nematodals are going to work on roundworms. Anti-cestodals are going to work on tapeworms. Anti-trematodals are going to work on flukes. Some drugs that we look at that are anthelmentics that kill parasites are actually might possibly work on two of these categories. So an example of this is something like Panacur. It actually has some effects against nematodes and trematodes. And so we have others that are going to be more specific. So like ivermectin, it pretty much works on nematodes and not cestodes or trematodes. And part of this has to go to the difference in physiology between these. A lot of times nematodes actually have a nervous system. Cestodes and trematodes do not. And like ivermectin and all your avermectins, they actually work on the nervous system. So if they're lacking a nervous system like a cestode or trematode, they're not going to work on them. So this is why we don't have one dewormer that gets everything, is that you have to look at the physiology of these parasites and understand how they work, and then understand how that anthelmintic is going to work to control them. So when we start looking at anti-nematodals, there is a whole list of different drugs that actually start working against nematodes. And some of the different ones I have here on the slide, but there's a whole book in here of anti-parasitic drugs that work against nematodes, and it's on table 15.4 on page 422. So you have your benzimdazoles, and these are going to be things like Panacur, Safeguard, so they're going to be known as Fenbendazole, albendazole, oxybendazole, fenbendazole, thibendazole, and a lot of these actually sit there on the benzimdazoles. They're going to work by actually interfering with energy metabolism, specifically through vitamin B. So they block vitamin B metabolism inside of the nematodes. And we have a whole, like I said, the list of them here that they end in azole at the end. Thibendazole has also, besides killing nematodes, has got an antifungal and an anti-inflammatory effect. Oxy and mebendazole have also been found to have some liver toxicity issues. So when we use them, we don't use oxybendazole in dogs that much. We use them in large animal. Fenbendazole has the widest spectrum. We can give it for multiple days in both large animals and small animals and get rid of a lot of different parasites. And it actually has an anti-trematodal effect too. And then your fenbendazole is metabolized with the animal and becomes a benzimidazole. So it's not in a benzimidazole form when you actually give fenbendazole to the animals, but it ends up, when it goes to the liver, it ends up becoming a benzimidazole and actually comes very close to being like fenbendazole and has a very good action and work to it. You have dendazoles, which is the levamisole family. It works against nematodes. We use this. This is probably the most effective one we have right now against barber pole in goats. Has actually been levamisole, and so we've used it quite a bit against nematodes in ruminants, and it has pretty good effects against things like ascarids, strongyls, whipworms, and hookworms. But it's really, really good against barber pole in goats, in sheep. Our tetrahydropyrimidines, they say it has an acetylcholine function. It might. I've read other studies that say it actually has to do with nutrient absorption across the walls of the parasites. But this is going to be your pyranopomates, tartrates, and moranyl tartrates. All these are in the family of the strongyte dewormer, the yellow ones you use. And what's really interesting about this dewormer is the others we've talked about have some ability to be absorbed into the systemic circulation, but these are large enough molecules on these pyranal products that they actually don't absorb into the bloodstream that readily, and they work strictly in the intestinal tract. So they have this very wide safety margin. Problem is if you're trying to get some parasite that's outside of the intestinal tract, they will not work on those whatsoever. But they're really good against pretty much all of your roundworms, and we don't really have that much issues with resistance to them. We actually do have quite a bit with the benzimdazoles because of the way they work, but we really haven't seen it with our pyranals. One thing to know about it is we can also use the pyranals in horses, actually work against your cestodes, that can actually work against the tapeworms that horses get. And that's one reason why we've kind of thought, well, acetylcholine is a neurotransmitter. They actually lack acetylcholine in the cestodes, so why does pyranal work? And that's why we think there's actually something else going on where it actually blocks absorption of nutrients by those parasites. Organophosphates, not really used that widely anymore on endoparasites. We use it mostly on ectoparasites, and it has a very narrow safety margin when we do use organophosphates. When I first started, we used it a lot in horses to go against a bot that the horse gets, the equine gastric bot, and that drug was soon taken off the market after I got out of into practice. In favor of ivermectin. It just was not used that much. It was called trichlorvos. So there's really not anything I've seen in the United States that's actually licensed on organophosphates for oral consumption for any pets for any type of dewormer. However, they are used quite often for treating ectoparasites on the top. Piperazine is one of the older dewormers we have, one of the very first ones we found, and it's only good against ascarids or roundworms. So that's its only effect, and it works by causing neuromuscular transmission. It blocks the neuromuscular transmission within the ascarids. So it has a very limited use. However, if you are having problems with just ascarids, just roundworms, it works beautifully against those. It's just not going to get any of your other parasites. Ivermectins, this is what we rely on heavily, especially in large animal now, and we use it also when we start looking at things like heartworms. We use a family of ivermectins to control those. And these work by actually blocking something called gamma acetic butyric acid, which is GABA. And this is a very important neurotransmitter. It actually inhibits neural function, slows it down. It keeps basically the brain from getting overly excited or the nervous system from overly excited. It basically blocks this hormone in the brain or the nervous system called GABA. And by blocking GABA, it then allows for this destabilization of actually the chloride channels and the neurons, and actually pretty much causes the parasite to go into seizures. And this seizure can actually kills the parasite. And so they have a very wide efficacy against your nematodes on the endoparasites. They're excellent against larval migrants, so the parasites that are going to be burrowing through and going from one part of the tissue into the other, because a lot of these parasites don't actually just stay inside the intestinal tract. They actually burrow out into soft tissue. And somewhere in their life cycle, they're going to have to go in there. So it's really good at getting those larval migrants. It also works on any type of biting or sucking ectoparasite. And so we'll use it a lot in large animal for that, for biting lice or ticks and different things like that. But we can also use it for things like sarcoptic and demodectic mange in dogs. So it has both efficacies. Instead, used heavily for heartworm prevention. For a long time, we didn't actually see any resistance. Now we're actually seeing some resistance in some heartworms to the ivermectins treatment, and sometimes we're wondering if maybe our dose isn't a little bit too low. One thing to know about ivermectins is you have to watch out using it in reptiles or fish or amphibians, because all of these amphibians, fish, reptiles, they lack brain-blood barriers, and so the ivermectins can actually go into their brain, and it blocks GABA, and it causes them to have a seizure and die. Avians and mammals have a blood-brain barrier, and so our blood-brain barrier keeps ivermectin out, and it keeps us from having a seizure. When we look at certain collie breeds and Australian Shepherd breeds, they seem to have some defect in their blood-brain barrier. If we overdose them on ivermectins, or the ivermectins, we can actually cause them to have neurological consequences too. Usually if you're giving the dose for something like HeartGuard or some of the other ivermectins, it's not really that much of a problem. It's when we're trying to use it for other uses or chronic, for like treating things such as extralabal sarcoptic mange or demodectic mange, and we're going to the higher levels. That's when we usually have problems with the collie breeds and with our Australian Shepherd breeds. Some of the others here we have are things like to work against nematodes is the depsipeptides. And so these are a lot of times actually used in combination with some of our anti-cestode drugs. We also have something called Profinder, which can be used in cats topically for the control of things like hookworms, roundworms, and tapeworms. But we do have to watch out because they can have side effects like lethargy, salivation, vomiting, and other neurological signs. Anticestodals, some of the major ones here are parazoquanils. So these are going to be, when we look at parazoquanil, this is going to be in the family of the pyrazide derivatives. There's also espeparantal, and so these are really good at working on tapeworms. And we can use parazoquanil both in small animals and in large animals to take care of tapeworms. Fenbendazole actually does work against the Tinea species of cestodes too. So fenbendazole has a lot of different things that it can work on. It works on trematodes, cestodes, and it has against specifically Tinea in the cestodes. It'll work against that, and like I said, it'll work on those trematodes. So nematodes, trematodes, and specifically tinea and cestodes. Anti-trematodals, once again, fenbendazole could fit into here, but there's also chloriosalon is one that we use quite often in large animals. And it's going, again, it's really good against some of our different liver flukes. Albendazole is one that we use a lot, specifically for different liver flukes and trematodes. And parazoquanol actually has some effects against lung trematodes in dogs and cats that they can get. It has an effect on those. So it works on cestodes, but it also seems to work on lungworms in dogs and cats fairly well. Anticoccidia. Coccidia is a parasite that ends up getting in the intestinal tract. And so we have several different anticoccidial drugs. They don't actually kill the parasite, they just control it and stop it from dividing. Our most common things we've used for years are sulfa drugs, and this actually stops the number of reproductions in the oocytes being shed, reducing the amount of disease spread over through the manure across the place where the dog's housed, or most of the time this is in cattle where they're housed, or in goats or pigs and stuff. And so we reduce the number out there, but we also reduce the number internally to where the body can actually start fighting them off. Some other things you can do are things like monensin against coccidia. This works fairly well, and it's given to cattle in the feed, and so it works very well at controlling them. However, you can't give monensin to other species to control coccidia because it is fatal to them. Going against Giardia, we have some other drugs that we can use, metronidazole, which is really good against things like Giardia and other protozoas. We end up using it also to go against anaerobic bacteria in the gut. So a lot of times if we think we might have Giardia or we have some type of maybe anaerobic bacteria that's growing, we'll use metronidazole. Fenbendazole has some effect against Giardia. It's not, and now bendazole does also. Fenbendazole is not really that strong anymore. We've gotten some resistance to it, but albendazole still does fairly well. And then, they're looking at vaccines for going against Giardia. Looking at tick-borne parasites, imdacarb is something that we use against Babesia species transmitted by ticks, both in large and small animals. Equine protozoal myelitis caused by Sarcocystis neurona. We have a couple of different drugs we use. We can use pyrimethamine, which is a folic acid antagonist. And so this is a drug that was used for many years. Now our main one is something called Ponzaril. It's the one that we used, our marquee. And so Ponzaril is the one that we use most often for actually treating Sarcocystis neurona in horses, which causes equine protozoal myelitis, or otherwise known as EPM. And this is the main treatment now, is actually using the Ponzaril. When we're looking at things like heartworm disease and trying to treat it, we kind of have to look at the stage of the heartworm disease that the dog is in. If we have a lot of adults, we have to use something called a miticide. And so a miticide is an adult cytotherapy, and this is the one that's approved now. There's several hoops you have to go through to get a miticide. It's just not something you can readily keep on your shelf. So you have to have a patient, and you have to supply some information to them. And when we do adult cytotherapy of trying to kill the adult heartworms, there's going to be a lot of care taken care of, making sure that those patients don't get too active, because these adult heartworms, as they die, can break off, and they can actually cause an occlusion in one of the pulmonary arteries and actually lead to a pulmonary embolism. And so when we do adult cytotherapy, we have to make sure that the client's going to do proper aftercare for that animal. Trying to prevent infection of heartworms, or trying to actually get rid of the young circulating heartworms known as microfilaria, to keep mosquitoes from getting those and passing them on and infecting other animals. We use a lot of our ivermectins to actually take care of that. The nice thing with ivermectins is we can give them monthly. They have very low side effects to them. if they're used within their proper dosage range. And a lot of times we combine other dewormers with them too to help keep the pets low on other things. So if you look at HeartGuard, it has pyrantel in it, which helps to get a lot of your roundworms and hookworms. If you come over to something like Interceptor with milbemycin in it, um, they actually have fenbendazole in there, which actually helps to get things like whipworms. So a lot of these products actually have other drugs in there that actually help them to also get a lot of the other internal parasites. And so the ivermectins have been very popular. Here recently, though, in the southeast part of the United States, we've noticed the resistance to uh, our ivermectins as far as trying to prevent third stage larvae from reaching maturity on the preventative, or trying to get rid of the circulating microfilaria. And we've actually had to go back to what we used a long time ago, something called filaribits. And filaribits were almost pretty much taken off of the market. And they've actually been brought back to some extent in those areas. And you have to give them every day. So instead of being to where you give it monthly, filaribits you have to give every day. If you skip a day, you have to go back and get your animal actually test it, because if they end up with any microfilaria starting to circulate, because filaribits work when the microfilaria first enter the body, and that's where it kills them at. If they get into circulation, you can actually end up getting anaphylactic reactions. So if you ever have to use filaribits, they have to be on those every single day. Other thing is levamisole actually can treat against and prevent heartworm disease. And this drug is given orally for a week, and then usually it's a daily dose with it. We don't really use it as much as we did years ago with things like milbemycin, moxidectin, and ivermectin that you can give monthly. But once again, where we're seeing resistance, and where we're seeing it is from the Gulf Coast of Florida back across up into Mississippi and up the Mississippi River to probably just about south of Memphis in the Mississippi River Delta. And so in those areas, we're starting to find that the things like levamisole are actually working very good against these resistant strains of heartworm disease. And so if you go to work in those areas, or if you have clients that come from those areas and you find a dog with heartworm disease, it's something to know that, if it's not working with your ivermectins, that you're probably going to have to go over and try something like levamisole. So the daily oral, what I was talking about on the filaribits is the DEC up here, the diethylcarbamazine. And so the patient has to have two negative, or must have a negative heartworm test. I said if they go off of it, you have to get them tested again. So the day off, you got to go have them retested, because this is the one that will cause them, if it gets in the bloodstream, this can actually lead to anaphylaxis, the way that it ends up killing the microfilaria. So they have to be on it every day. We've had to go back to it once again due to resistance. Monthly is your ivermectins, milbemycins. Those are oral. Selamectin is topical once monthly that we can put on top of the skin and works against heartworms. And then your moxidectins end up being an injectable preventative that we can end up doing about every 6 months when your ivermectins for heartworms. Adult cytotherapy, this is melarsoline as a miticide, and so the miticide is going to be given in the epaxial muscles. It's a lot less toxic than our former drug, which had to go IV, which was basically arsenic, and so we used to inject them with arsenic to actually kill these. And so much less toxic, much easier to give. It used to be that you'd have to give the arsenic shots probably about 4 different times spread out. You hope that it didn't get outside the vein, because if it did, you got a raging phlebitis and a lot of times necrotizing lesions from that. That was very toxic to the body because you're injecting arsenic. The emiticide does have some worries with nephrotoxicity and hepatotoxicity, because a lot of times we like to go ahead and actually draw blood before we actually give these to make sure the kidney and liver functions good. There's some other precautions that we take when we do adult cytotherapy that's not in here, but we're going to do things like put them on prednisone when we get ready to do the treatments, to where if they happen to have any type of allergic reaction to the dying heartworms, we have that controlled. And there's going to be inflammation also from their death, so we're trying to reduce those. The other thing we do is we found out that a lot of these adult heartworms actually, from probably the mosquitoes, we think, actually end up with some bacteria in them. So before we do the adult cytotherapy, we usually like to do about 2-week treatment of a tetracycline. So right now the one that we're using here is um, uh, minocycline is the one because it's reasonable in cost and we can actually get our hands on it fairly easily. Some of the other tetracyclines we used to use we cannot, but we'll actually sit there and treat them with minocycline for probably about 2 weeks before we actually do the adult cytotherapy. And then eradication of the circulating microfilaria. Once again, using ivermectin, milbemycin. In those areas where they're resistant, we're back to using levamisole. Infrequently used used to be, but if you're in that area or if you have a pet that comes from that area, say from Pensacola to Lafayette, Louisiana, and then up to Memphis, Tennessee. You kind of draw an area there up and down the Mississippi River and along the Gulf Coast. Those patients a lot of times, and in that area they're using levamisole heavily because we have gotten resistance to ivermectin and milbemycin. Once again, the thought is maybe that these have been too low and we've actually kind of bred some of the resistance in. So when we do the levamisole, they're usually using a higher dosage of it. Some people have had luck by going to higher doses of ivermectin and milbemycin. The thing you have to watch out for is by doing that, you can't do that in those collie breeds or in those Australian Shepherd breeds. Ectoparasites, there's different ways of doing this. It can be topical, dips, pour-on, shampoos, dust, powders, foggers, oral medications, injectables, and even your oils like for a lot of your avermectins will also sit here and work on ectoparasites, so that's something to know. Um, Specifically in large animal, things like ticks or some of your different biting flies, definitely your lice, it'll take care of. In dogs, your avermectin, specifically ivermectin, will take care of demodectic mange and sarcoptic mange and does a very good job of it. Some of the different ways of doing it is to actually use things like sprays that you can easily apply on the animals, like Adams. And a lot of times these products actually have things like pyrethrins in them. That will actually sit there and kill the parasite. Be careful when you handle them or at the pet afterwards when they're wet. And be extremely careful when you're using these pyrethrins or any type of organophosphates with cats. If it says for dogs, you can use it on a dog. If it says for a cat, you can probably use it on a dog. But if it says just dogs and nothing about cats, don't ever put it on a cat because you can cause them to go into a life-threatening crisis very fast. A lot of these drugs block acetylcholine, and that's how they kill the ectoparasites. Cats are very sensitive to this, and they get a toxicity. So organophosphates and your pyrethrins, they will. And a lot of times to save their lives, we have to give them massive doses of atropine and try to ride it out until the drugs clear their body, but that can become very life-threatening to them. They get something called sludge. They get salivation, lacrimation, urination, defecation, some GI issues, and then they get this really slow heart rate. And so the heart rate goes way down. They have this neurologic change. They're salivating heavily. Their eyes are dilated. And it's a life-threatening situation for them. So, you know, when we're looking at some of these products as far as if they've got something, a chemical in them that has got a pyrethrin or an organophosphate, we don't use those on cats. And you have to be careful with them in the environment too. There's concentrated sprays you can put on. There's different dips that we can use on the patients. Pour-ons, there's some different ones that we do, or spot-ons. Pour-ons we use more on cattle and our livestock. Spot-on treatments we use a lot in our equine and in our small animals that we can actually use to control ectoparasites. So things like Frontline are actually spot-on products. There's different shampoos that we have that are flea shampoos that you can get over the counter, and then there's some that are veterinary. Dust, we use a lot of dust and powder in large animals, in cattle and goats that can go through, and we actually have a powder that they walk into some place to eat, and there's a bag there, and when they walk through, they kind of bump the bag, and it lets out a little bit of the powder across their back, and it controls flies, ticks, and other parasites. Foggers we'll use to control the environment inside the house. And of course, we talked about our drugs as far as our oil products and our injectables. So we have a lot of different chemicals that we can use. We need to know which ones we need to have protective clothing for. We want to make sure that we have good MSDS sheets for signs of toxicity, both in the animals and for people. First thing is your pyrethrins and pyrethroids. So you're going to find these in things like Adam's fleece dip and sprays. You're going to find them by things like Mycodex shampoos or Biospot shampoo, Duocide spray. So there's a whole bunch of different things on there. A lot of your Hearts and Sargent products have these. And these are the ones that you really have to be careful with when we're using it in cats. Cats are highly sensitive to these. They can end up becoming lethal to them very fast. And then we have to make sure we're using them in the right concentration stuff in our small dogs, because it's very easy to get too much on them also. We have insect growth regulators, so things like Ovitrol that we can actually give that the animal can take, and it actually ends up working to control the growth overall of the insect and actually stops it. So whenever they bite or ingest, they're not actually able to get any, they're not actually able to grow anymore, or it'll actually inhibit the larval stage from growth. Chitin synthesis inhibitors, this is going to be by the name of Program. Also, they have Lufuron, which is in Program, and Sentinel, and this can actually be used to actually stop the growth of the outer shell of the fleas, and so it causes all the fleas to die all at once. And then it's actually even in something called Capstar that we can use. Capstar causes an immediate kill, and so it's not like a long-term treatment, but you have an animal that comes in and has a lot of fleas, we can use the Capstar. It has the Lufuron in it, but it also has another drug called Nitinpiram, which kills the fleas right away. So it kills the fleas that are right away and makes sure that any of the fleas that eggs that maybe were laid right after they were bitten with the Capstar, that they won't actually those eggs won't actually grow to maturity, because it inhibits the chitin growth. But it's only going to work on those fleas that bit for that period of time. It's not going to work on anything in the environment, because Capstar is an oral medication. And that's the next one down on the list when you look here is your Nitinpiram. And so the Capstar, so this one right here actually binds and inhibits acetylcholine receptors fairly quickly in the fleas after you give it to them, the animals, and you can literally give them a Capstar and watch them within 15 minutes, all these fleas just jumping off and dying. So it's a really neat product, and we use it quite a bit. In cats, we use something called Vectra, which does the same thing. So Capstars we use more in dogs, and then Vectra we use a lot more in cats. Some synergists that we can use are things like Ecofoam and Tick Dust 2, and these actually have some activity against arthropods, and they're found in some different shampoos, sprays, and dips for fleas. We have our imidacloprid, which is Advantage. So there's different types of Advantage. There's canine Advantix, and then there's regular Advantage, and there's Advantage 2. Advantage is out there for cats. Canine Advantix is strictly for dogs. The things with Advantix is it also not only kills fleas, but it also will kill and repel things like mosquitoes, and can actually work on several different types of ticks. Whereas the Advantage just works on just fleas. The Advantix actually works on certain types of mosquitoes and certain types of ticks. There's the phenyl pyrozoids, which is your fipronils, your frontlines, and your frontline pluses. The advantage of frontline is that it kills ticks, does really good in the short term, does a really good job at killing fleas. The frontline plus has actually got an extra ingredient in there that actually keeps the larva that's developed in the eggs from the fleas from actually hatching and becoming adults. And that's the difference between the two. The straight front line kills fleas, kills ticks within the first 2 weeks of being applied. Frontline Plus will do the same thing, but the advantage of it is not only does it do that, but it actually keeps any of those eggs that might be laid during that time from actually hatching out to an adult. So from the time that the fipronil is ingested to the time that the flea actually dies, if they lay any eggs, those eggs will not actually develop into maturity. The thing that you have to understand with both of these products, sometimes that you will use these topicals of Advantage, Advantix, or Frontline on an animal, and people are like, well, it doesn't seem to be working. I see all these fleas come into the service and they're still moving around. Well, they work on the neurological system, and so when the fleas get exposed to them, they actually start killing them within about 15 minutes, but it takes a couple hours for them to die. And so there are a lot of times people will sit there and look at them and say, it's not working because I still see the fleas moving around. They'll call you after they put it on. They're moving all over the top. Well, what's happening is if they're coming up to the top, they're getting ready to die and fall off. It just takes some time for that to actually happen. There's been Promaris on the body, which that's used on top of the body, which takes care of fleas, and can be used in dogs also against ticks. And then we have our avermectins. We have things like Revolution selamectin, which has been used, which actually controls fleas and heartworms and ear mites and hookworms in cats. And in dogs, it also works on fleas, flea eggs, heartworms, ear mites, sarcoptic mange, and the American dog tick. And so it's been a very popular product for that. We have our different ivermectins that we use orally and in the pour-on in cattle, orally in horses. And these have an effect against things such as biting lice and different types of mites and manges that they can get. And they can even be effective against certain types of ticks. Doramectin or Dectromax is an injectable solution that we use in cattle for biting lice. And it can also be used in dogs and cats for the same thing for demodectic mange, specifically in dogs, but we can also use it somewhat for being able to control ectoparasites. There's also a pour-on form of it, and we've used it in cattle, and we've used the pour-on extra label in dogs and cats. There's Eprinax, and so this has been a pour-on that we've used in beef and dairy cattle. Works both on internal parasites absorbed in the body. It's an ivermectin-based product in there, and so it does your internal parasites really good, and does an excellent job also on the ectoparasites, and gets things like cattle grubs, lice, and horn flies, and it does a really good job of taking care of those. We also will use the pour-on version of this topically in rabbits for ear mites in rabbits that they get that's really bad. Comfortis is something that we've used. It's a chewable flea protection product in animals 14 weeks or older. And it kills fleas within 30 minutes, and they're completely dead within 4 hours. And Comfortis has worked fairly good for us and has a fairly long acting. It's fast acting and fairly long acting. You do have to watch out for things like vomiting, anorexia, and diarrhea and stuff. And once again, if it's labeled for dogs, use it only in dogs. If you have it labeled for cats, you can then use it in cats. We have some of our different topical dips like Mitaban that we use against demodectic mange. And it works fairly well. It's just you have to watch out for your own toxicity and the toxicity in the animals. You can't use it in things like cats and rabbits because it can actually end up being lethal to them. Lime sulfur dips, we have used this actually a lot, lime sulfur, to treat things like ringworm and different funguses. And then there's also some anti-parasitic forms that we can do of some different types of manges, chiggers, different mites and lice that it's effective against. DEET, things like OFF, we've used a lot of DEET to actually sit there and block things like biting insects such as mosquitoes and different types of flies. We have VIP flea dips and shampoos, which have D-limonene in it, which is a citropeel that has some insecticidal activities to them. And it provides a quick kill. There's really no residue on them, pleasant smell. We'll mix it with other products. The thing of it is it's going to kill right then and there, but there's no residual to it. And so this pretty much goes over a lot of the different ones that I've just talked about right here. That's all in the book. And so if you go and start looking through your book at that table, 15.6 on page 434 to 439, you're actually going to see all these that I just talked about right here. That ends up being antiparasitics.